Hello friends, let us now learn some important points about the occupational health. In the occupational health, first we have occupational diseases. Occupational diseases are divided into three types. First we have physical diseases. Physical include those which are related to heat, cold, light, pressure, noises, burns and injuries. Heat includes heat stroke, heat pyrexia, heat exhaustion. Cold includes cold chilblains and frostbite. Those related to light includes cataract and Meniere's nystagmus. Those related to pressure includes Caisson's disease. Those related to noise are deafness. Those related to radiation are leukemia and aplastic anemia. Then those related to chemicals are gases, poisoning, dusts like pneumoconiosis, metals and chemicals again causes poisoning. Then we have biological agents which include brucellosis, anthrax and leptospirosis. This also includes occupational dermatitis which includes metal exposure. Then this also occupational diseases like occupational carcinoma are also the occupational disorders. Now let us learn some important points about the ergonomics. Ergonomics is a science where we study people's efficiencies in their work environment. It is a science where we study people's efficiencies in work environment. So we have one pre-placement examination. Pre-placement examination is done before or at the time of employment. It is a foundation of an efficient occupational health service. So this is the physical and clinical examination which is done for the person just before the employment. Here we take the workers' medical, family, occupational and social history. We do the physical examination and biological examination and also radiological examination of the worker. In pre-placement examination, here we take the right person in right job. This pre-placement examination also serves as a useful benchmark for future comparisons. So it is a good point for future comparisons and for knowing the present situation, health situation of the worker. Then we have the next examination is periodic post-placement examination. After the placement, regularly at regular interval we will do examination. Most commonly we will do annual examination, but for some jobs like radiation exposure, the examination is done once in 2 monthly, whereas examination is done monthly for occupations involving the lead, radium, dye stuffs exposure, and occupations involving daily exposures. For occupations involving daily exposures, we have dichromate exposure. And this periodic post-placement examination is done to detect any physical and mental issues and secondary level of prevention. This is periodic post-placement examination. Then we have something called as types of ergonomics. We have 3 different types of ergonomics, which are physical ergonomics, cognitive ergonomics or engineering psychology. Then it also includes organizational or ergonomics or macro ergonomics. Physical ergonomics includes These will deal with human body's response to physical and psychological stress. Is physical ergonomics. Then we have cognitive ergonomics. It is concerned with cognition is intelligence. So it is concerned with mental process affecting the interaction among the humans and other elements of system like workload and training. We can tell it is psychological issues comes under the engineering psychology. Then we have organizational and ergonomics or macroergonomics, which are concerned with optimization of systems, that is motivation, teamwork, supervision and ethics comes under macroergonomics. Then the next important thing here is about the sickness absenteeism. Sickness absenteeism, this is a useful index in industry to assess the health status of the workers. The causes of sickness absenteeism can be medical causes, social causes, economic causes. Sickness absenteeism is just taking leave, that is sick leave, due to any cause. So methods to decrease sickness absenteeism can be by good factory management and practices. It can be by adequate pre-placement examination. It can be by good human relations and also application of ergonomics. Then the rate of absenteeism reported in India is around 8 to 10 days per worker per year. So these are the important things in occupational diseases. In the next class we will learn about the two important acts, that is Factories Act and Employees State Insurance Act. Thank you guys for watching my lecture. Thank you.